And I'm a prevention specialist working with the Prescription Playbook. And we are super excited for today's webinar called The Mind and Body Connection in Athletic Injury and Recovery with Dr. Sterling Elliot and Dr. Dylan Edwards. I'm super excited about this topic myself as a lifetime athlete and college athlete who dealt with injuries. I totally understand the mental toll that it can also take. So I'm really excited to have a conversation today about the ways that we can support our athletes, our communities, our kids on the ways to prevent injury and to help them when it does happen and how we can really help that recovery process. And so to introduce our speakers, we have Dr. Sterling Elliott. Dr. Sterling Elliott is a clinical pharmacist and pharmacy team lead for ambulatory surgery practice at Northwestern Medicine Memorial Hospital right here in Chicago, Illinois. Dr. Elliott also maintains an appointment to the faculty of Northwestern University's Feinberg School of Medicine as an associate professor of orthopedic surgery. He specializes in pharmacy related to surgery and procedures with particular expertise and issues related to post-operative pain management and ambulatory surgeries. Quite the resume that Dr. Elliott has there, and so much work he's done within orthopedics and pharmacy at Northwestern. And we also have Dr. Dylan Edwards. Dr. Dylan Edwards recently became a doctor of physical therapy and a certified personal trainer with nearly a decade of experience in both of these fields and in fitness and sport performance. Dylan is a physical therapist that works with local athletes at the Tom Nelson Training and Sports Performance Center in Mount Prospect, Illinois. As a former high school athlete himself, Dylan has competed in football, track and field, rugby, and experiences that have greatly influenced his understanding of the physical and mental demands placed on athletes. So, without further ado, I'm going to turn it over to Dr. Dylan and Dr. Sterling and or Dr. Edwards and Dr. Elliott, and we are going to get started. So, thank you both so much for being here today. As the PowerPoint or as the session goes on, I'm going to turn off my camera so that we can really give all of our attention to our speakers. My wonderful team lead, Abby, is going to be moderating the chat. So if anyone has any questions, throw them in there and we will try to get to as many as we can at the end.
Terrific.
Okay.
Yeah, awesome. Thank you, Erica.
So to start, tell us about your current work and what role it plays in positively impacting athletes.
Sure. Dylan, why don't you go ahead and start?
Sure thing. Well, as Erica mentioned, I work at the Tom Nelson Sports Performance Training Center, and I primarily deal with rehabbing the injured athlete of any kind, of field sports, court sports, you name it. And the way that I'm able to positively influence athletes is that I'm lucky to be at the training facility where many of these athletes train locally, and so if there's an injury during the season or during their training, I'm able to very swiftly and effectively communicate with their training staff and strength and conditioning coaches to ensure that they have the resources to safely and effectively get back on the field or court wherever they perform.
Sure. And I think, and that's, that's really, as we're here talking, that's a critical element, right? That's the element that's going to bring athletes back to their ability to perform. And as we all know, that's what every athlete is looking to do, right? That's a singular mindset almost when it comes to the competitive element of their existence. And so when there's an injury, an injury is physically traumatic, but it's also mentally traumatic because it throws you off your plan, it throws you off your game. Athletes, a lot of them become necessary creatures of repetition and success of that repetition. And so a lot of my work is really spent in and around the very immediate phase, the really acute phase of the injury scenario. And that's where we know what the damage is. We know the damage is significant, and the damage is going to require repair. And after the repair comes the immediate issue of dealing with the pain of the repair. And so a lot of my work focuses on trying to help patients of all kinds, be they athletes or regular humans like those of us on this call. Uh, it figure out a plan for how to effectively manage the pain so that we can make it as quickly as possible to that point where you recover. Because the point where you recover and rehabilitate is the point where you really, really get better, right? Dealing with the pain is that sort of immediate phase. You try to teach athletes that and try to teach them, especially when you work with athletes. Think about this as a brief moment in time. This is the injury. The injury is going to be repaired. The pain is going to be left over from the repair. We're going to get you through that, and we're going to bring you to that all important phase where you're going to spend the time with someone like Dylan. And I think that's really important way that I try to positively impact the injury scenario for an athlete, is to let them know this is reality. This is part of reality. You get into this. This is the cost that comes with all the glory, right? And so we'll get you through that. We're going to figure it out. We're going to make you feel comfortable about it. And then we're going to bring you in a very efficient way to that point where you start doing the real work of recovering and rehabilitating and getting better.
Yeah.
Both
Very well
such
said.
important steps to that recovery process. Having the support from your doctor, your pharmacist, and then also that support from your PT goes such a long way. So what does it mean to both of you when we say mind and body connection?
Well, I think to me, it means sort of what we were just talking about, right? There is, when it comes to an injury of any sort, no matter what your lot in life is, but especially when you're an athlete, an injury is this incredibly disruptive event, and it throws you off literally throws you off your game. And it throws you off of the things that you do in the course of a day and how you do it well, right? And so I think that for me, when an injury happens, it's as important to make sure that an athlete understands that this should be a moment in time. This should really be a relatively brief scenario. It's an interruption, but when that interruption is done, we're going to get you back and we're going to help you get back. And I think that's the positive goal-oriented direction that an athlete needs to succeed in any phase of what they do. But I think it's particularly important for us when we're taking care of injured athletes to think about it in that way too. And I try to involve that in the discussion of some of the details of what you're going to use to help get better.
Yeah, that's well said, Sterling. And I like to say with the athletes that I work with that it's an opportunity for personal improvement, an OPI. And and from my perspective, the mind is the body is the mind. Whether it's an athlete or I have an aunt that's a postal worker who recently had a knee replacement, and she's been a postal worker for 20 years in total disruption of daily activities and going to work, seeing who she sees every day, her total lifestyle, if you will. So especially when we're talking about specifically the student athlete, injured athlete, sometimes an injury, they're in places they've never been before, personally, in life, and being injured can almost be, it throws off who they are, their identity, and they could be put in a place of almost helplessness. So kind of highlighting the yellow brick road, if you will, of like Sterling said, it's it's not over, and this is just the beginning, and now we're on a different route and path for you to get better. And it's a process, and trust the process and have patience with the process. And you're a young athlete, you're going to feel amazing, probably really quick, but that doesn't mean you're immediately game ready to get back into the championship rounds, if you will. So
I love that concept of it's a time to improve yourself personally. Even if you can't necessarily be working on your game or whatever it is right now, there's still things you can do to keep working towards the person you want to be. I love that. So when working with athletes or talking to patients, how can we help them to better listen to their bodies, to understand injury and what our bodies might need to support that recovery process?
Yeah, I think, certainly for me, that's a critical part of talking about dealing with the post-operative pain for an athlete when surgery is part of the prescription, so to speak, for healing, right? And one of the things that we try to teach patients to do of all kinds, be they athletes or anyone, is to really understand how they're functioning, how they're working in the setting of pain, right? And we give them 7 questions to ask, and I always like to joke with them. It's the 7 questions you should ask yourself in pain, which is sort of similar to George Carlin's 7 words you can't say on television. George Carlin was a lot funnier than I am, but in any event, one of those items that we talk about is, are you making progress through the day, right? And that progress should always improve over the course of the recovery time. And so I think that's a really helpful thing to do, is to help an athlete say, okay, am I making progress? Am I doing more in this recovery, in this rehabilitation that I was able to do 2 days ago or a week ago? Things like that. And I think if you frame it that way and you look at trying to identify successes, even if they're incremental and even if they build over time, I think I think it's a strong way to help anybody recover, because it sort of focuses the attention on an element of positivity. And I think particularly in the world of athletes sort of thrive on it. It's sort of the currency of their success is positivity, right? I mean, athletes, even when they're not injured, they look at it and they say, well, did I do that well? Did I run that route well? Did I hit that cross well? All those types of things. And so I think if it's important really to deal with athletes to frame it in positivity. That's how I look at it.
Breadcrumbs and Scooby snacks.
Yeah, right.
Success leaves clues, breadcrumbs, and Scooby snacks. That's one of the things I say, 5 billion times to my athletes and my patients. And Sterling, you hit it perfectly on the head. Like, are you running away from something? Or are you running towards something? Are you running away from your injury and trauma and mentally, physically that all caused? Or are you running now towards a new goal, and which is get back on the court of the field? And it's the small wins. And as a physical therapist, and goal setting is huge, and small short-term goals, long-term goals. And the more that athletes know what those are, and the more that athletes and parents and other adult impactors are involved in that goal setting and those, the small wins and the big wins, then yeah, that next rep, best rep, whether it's something as simple as, let's just get that knee extension back or the knee flexion back and we're doing heel slides or ankle slides, things that may not be as flashy and cool and fun as some of the lifts that they were doing for sport, or some of the skill stuff that they were doing for their sport. So definitely trying to find the positivity and just bring it to the rehabilitation, and just bring it to the whole process of, from all sides of the healthcare team. That's huge for the athlete and the parent, and that can be infectious all around. In a good way, good infection, not bad infection, not red flag infection.
Right.
Yeah, that really like human first approach way to like dealing with injury recovery and celebrating the small wins. I know how excited I was when I could flex my quad muscle again after knee surgery, so it's one day at a time. So what are some things that athletes can do to help prevent injury?
Sometimes it's unfortunately something that just happens. I mean, it's just the nature of certain sports. Some sports have higher risks than others, but certainly controlling the universal elements, as I call them, which first and foremost, sleep, nutrition, and then like stress management mitigation. As a student athlete, are you taking care of all the stressors of, homework, student life and all that. And then of course your fitness and your training and your skill routines, and that's stress management as well. You shouldn't just go out and hit it hard and 5, 6 days a week. There's ebbs and flows and um, ways to do things so that you can handle things accordingly.
Yeah, I would agree. I think that one of the great, to me, one of the great traumatic elements of an injury for an athlete is that you simply don't, you understand it's a reality, you understand it's a possibility, but you don't expect it. You don't expect it because it quite frankly throws you completely off all your goals and everything you're trying to achieve, right? And so I think that, as Dylan talked about, good solid conditioning, good solid training. I think, when when it's time for physical fitness and conditioning and training elements that aren't necessarily related to the skills, you got to take those as seriously as you do work on your shot, work on your blocking technique, work on hitting holes and things like that and cutting, right? And I think too, Dylan hit on it, and you talk managing stress and things like that, right? Because sometimes some of these injuries take place because you lose that attention to detail, and sometimes it's not even a really conscious attention to detail, but it's that quality of motion and of action in those repetitive elements. And when you're stressed and your mind is in different places, you sort of lose the focus and the attention to detail. And those are those opportunities where sometimes you have joints and soft tissue in the joints that are stressed in a way that you didn't intend to. And combine that in sports that have elements of significant physical contact, you know, losing attention to detail combined with the wrong situation at the wrong time, and there can be a recipe for an injury that maybe we all weren't intending for you to have. So I think those are important elements to think about as well.
Yeah, quality matters 100%.
Yeah.
And in today's age with sports performance at every level, there's so much information, there's so many resources, there's so many brands, there's just a lot, and it's easy to think, and this comes back with listening to the bodies, but listening to the brain, is something that is important to talk about too, especially with some of the young athletes I deal with. They're really fit and in shape, and they get injured, and as soon as they, get out of their boot or get cleared out of their brace, I sometimes it's, oh, I felt really good, and went on like a mile run, and why did we do that? Like we haven't even started doing, we didn't even start walking yet, or we didn't start doing 10-yard runs. And so that, mechanically, if we can't do, 5 yards right or 10 yards right, we're not mechanically running sound for a mile. And
Yeah.
yeah, so those just educational components like that are, that's what
Right.
we're here for sure.
Yeah, I love that. It's hard when, like Sterling said, you can be doing everything right, and if your body gets hit in the right place at the right time, you can't control what happens to it. So helping athletes to just take those small steps of, trust me, once you can comfortably run these 20 yards, we're gonna increase it to 40, then to 60. So definitely love that.
Yeah.
I'm just wondering if there are any particular like exercises or physical things that you have both seen work to help prevent injury, or to help kind of reduce pain.
So the first part of that question was exercises that prevent injury, and then
Yeah, that can help to prevent injury.
um, yeah, things like just ensuring proper limb symmetry index, like LSI, like make sure your left and right sides are performing within a reasonable amount of of function. Like if your right side is performing at 100%, and we test your left side, and if it's 70%, for example, over time, that's and repetition, then we're asking for some sort of injury from compensation, and just not being equal and balanced, if you will. Being able to run and jump and land again with left and right sides. So everyone's kind of different. Sports are kind of different, and depending on what you do, the body kind of adapts and is really intelligent. So like if you golf a lot and you're a golfer, your spine may start to curve and tilt a little bit because not many people, golf ambidextrously. Same thing with like throwers, throwing athletes. They usually, very rare to have someone that would be a right-handed and a left-handed thrower. So depending on what the person is doing, that kind of the big PT answer, the big physical therapy answer would be it depends for what we're going to do to prevent injury. Sterling's laughing because he knows that's there's bumper stickers and T-shirts made for it depends, literally.
Right.
But yeah, and then that goes with pain reduction too. So if I work with a lot of throwing athletes, quarterbacks, pitchers, and if you throw a lot, I call it the Grand Canyon effect. Over time, there wasn't a canyon there, and over time, rep by rep, grain by grain, rock by rock, now it's now we have a giant hole in the ground. So we kind of have to reverse what was done, so to speak, and start lengthening and strengthening some of those anterior structures, the pecs, and shortening and strengthening some of those posterior structures. And like I tell all my throwers and anyone that has instability, we can't shoot a cannon from a canoe. So we have to build like a fortress.
Yeah. Yeah. And I think, from a pain perspective, it's going to sound really simplistic, but it should. Strength and conditioning is critical, right? Strength and conditioning is critical because the typical pain sensation that an athlete is going to feel is going to be a lot of times the consequence of swelling from inflammation, right? And inflammation is a necessary part of the human process. It's there to stabilize when you're destabilizing by creating pressure. It's there to help heal, believe it or not. You need some of those inflammatory components in your body to help create healing. And healing is necessary because you do a lot of stress, a lot of physically stressful and straining work on the tissue, and it's going to cause injury to the tissue, and so your body's going to want to naturally heal it. And when you feel pain, very often the pain you're feeling from the consequence of a physical effort is that you're feeling the swelling and inflammation, and it's hitting those receptors in your nervous system that are designed to feel swelling and inflammation, but to send your brain the message that this hurts because you weren't addressing the feelings of pressure and stiffness that came before it, right? And so your body is wired nicely to have those similar sensors. They're there to sense pressure and stiffness, but they're there to send your brain a very different message, right? And so I think those are critical. And when you feel it, and when it's there, to deal with it. There is a very good reason that when you watch a post-game press conference after a Major League Baseball game or an NFL football game or a big college football game, that the pitchers and the quarterbacks always come out with the shoulder and the elbow wrapped in ice. We're trying to deal with inflammation and the strain of it before it rises to the point of giving you a painful signal, if that makes any sense.
Yeah, like really listening to your body and saying, instead of just putting this off until it actually is an injury or becomes a problem, what steps can I take to make sure we don't get there?
Yeah, very much so.
So when injury like does occur or people start to notice that they're maybe having some pain, what are some ways that we can support that pain or those injuries outside of taking medications?
Well, I think it comes right back to what we just left in the previous one. And that is that you see when you feel pain, when you feel injury as an athlete, you get it addressed, right? Don't address it on your own. Go see the training staff. Perhaps the training and listen to the training staff if they tell you we need to get the input of the right. And very often that's going to include the time honored uh, therapies of pressure and temperature, specifically cold, right? If we've got swelling and inflammation, putting some pressure with ice when that's suitable without causing further image and injury and damage to the injury to what's the issue at hand, that's a really great way to manage the swelling and inflammation so that we don't build to that point of debilitating pain and more injury.
Yeah, and then when we're at the proper phases, definitely integrating movement to help with some of that inflammation. Arteries bring the blood away, and then the veins have to bring the blood back, and the venous system has valves that we have to use the muscle pump system. And my athletes hear me say, we gotta pump away every day, and kind of get some of that to go back up at the proper point. So we relieve some of the inflammation, help with some of that pain. And then on the longer duration aspect of recovery, a lot of things that I talk about is if you have a lower extremity injury, we're still within, precautions and within guidelines, doing upper extremity exercise, which has a lot of benefit physically, mentally, and helps with helping mitigate pain just because now we have, some activity that's going through, and yeah, a lot of different reasons why that's successful.
Yeah.
So you just brought up a really good point and concept about thinking about the long game of the recovery process after an injury happens. What are some of the practices that coaches or ATs, PTs can help to instill in individuals to support their long game or their long-term recovery from their injury, whether that's looking at their injury or helping them to do things outside of their sport?
Yeah, I think, like I said, it's an OPI, an opportunity for personal improvement. And there's a lot of buckets to fill to get better. There's a lot of ways to get better. Journaling is something I talk about. I'm kind of big on virtual reality in certain ways, but that's a kind of another discussion. But still, being able to uh, get reps in, and but really from like the adult impactor side and from my side for the long-term goal of like it comes back to goal setting and working with the athlete to determine, what is it that we want to do? How are we going to get there? And what are the Scooby snacks and breadcrumbs that we got to follow to solve this mystery together, if you will? And, I think for the young athlete and the young person, the young student athlete, being able to create a plan and then work backwards to get to said plan is a powerful tool for the long game of, talking about athletic injury and just the long game of this game of life we're all playing.
Yeah, I mean, I think the benefit to the long game element, so to speak, is what are you doing in the off season, right? It's so easy in season. You become a regimented practitioner of all that's necessary, whether it's physical fitness, conditioning, and skill development, and then applying skill and all those things in the course of a contest, right? Um, but it's sort of what do you do when there's downtime in the off season when you have those opportunities to sort of self-direct and self-guide, right? And I think for a lot of people, listen, certainly young athletes, but it doesn't have to be young athletes. Seasoned adults have this issue too, where we sort of don't keep moving ourselves and self-motivating ourselves to continue in a positive pathway. And so I think developing those skills and sort of helping young athletes develop those skills is critical. Look, do you have to go do a workout 6, 7 days a week? No, you don't. But do you need to do it more than once a week? Yeah, you do. right? Because if you don't, then you're going to have deterioration of some of the physical building blocks that are going to be a key to success. And if you don't keep those in shape, then you may end up finding yourself when the next season begins in that race to run up to speed. And sometimes that's where you outpace your body's conditioning, and that can lead you to an injury you really never intended to have.
And that's again where I like to talk about breadcrumbs and Scooby snacks in the perspective of, it's a busy life for again, not just for the student athlete, but for adults and everybody. Sometimes we're pulled in a million directions. So
Yeah.
goal setting and being realistic about what can we do, when can we do it, and when are we going to do it, and just being detailed and specific about those goals and kind of how you're going to get there is just those are good ingredients to help solve the mystery again.
Yeah, and I think, listen, as you're talking to your young athletes, the professional athletes are very often the role model, right? Like that's the shining star, that's the gleaming trophy that younger athletes are looking at. And one of the things that you'll hear all the time from professionals, particularly aging professionals who are transitioning to that phase of their life where they are no longer daily practitioners of the craft, is that they'll tell you that they knew it was time to get out when they no longer wanted to do the work to get to the game. And that's a hallmark of when an athlete tells you, a professional athlete tells you, I'm done, dude. It's it. Right? And we see examples of athletes who say, that's it, I'm done. And then they come back. And very often what brings them back is they realize that they haven't yet lost the desire to put in the work, right? And so they're willing to keep going out and doing it. They left because maybe they just thought they were tired of getting hit on Sunday. Everybody's tired of getting hit on Sunday. But what you have to become tired of is going and watching the film and doing all the work on Tuesday through Saturday, right? Um, and so I think it's helpful to let people know that that's still an overarching principle. Now, it may get applied differently because it's not your job. It's not a high paying job with all those pressures that come with retaining a job. But still, you can sort of harness those for the athlete and say, look, you want to keep going. You want to keep doing this. You want to get out of this cross country season into that track season. Well, there's work to be done. It doesn't just, it doesn't stop in November and start up again in February, right? And so I think those are important elements that we can pass along to the athletes.
Yeah, I love that. I know that one of the things I often hear our sister project, the Human Performance Project, talk about when it comes to things like nutrition is that, excuse me, it's not just like what you're putting in your body in the days leading up to your game. Excuse me again. It's how you are feeling yourself after the game, how you're continuing to focus on your nutrition so that you're like you said, Sterling, you're not just good at the end of November and then you pick it back up in February before preseason. It's how are you taking care of yourself throughout that whole period of time.
Yeah, I mean, listen, Tom Brady was legendary for that, and that's how he played into his 40s, right? I mean, it's not really. Yes, he was fortunate not to have a debilitating injury, but a lot of that was Tom Brady putting in the effort to maintain the ability to get to July. Um, and so you see that a lot. And there was a point in time where the great Tom Brady said, "Us, that's enough," right? Um, and so you see those things, and those are, I think, important things to have conversations about with athletes. They model ideas, maybe not necessarily replicating the behavior, if that makes sense.
Yeah, totally. And I feel like that's a really good segue into our next question, which is when athletes do get injured, what are ways that an actual, I know Dylan mentioned journaling, which is such a great one for your brain. But what are some other things that athletes can do to support their mental health throughout the recovery process of an injury to help avoid that they turn to unhealthy coping skills or turn to things like substance misuse?
Yeah. I would say that it's critical when you have an injury to be around the team. And any good any good team is going to encourage that, right? Any good coach is going to encourage that. I think sometimes that's a hard thing for athletes to sort of um, get on board with, right? As well, I'm injured and I can't practice and I don't want to watch it because it's just going to make me feel um, like I know what I'm missing. But it can also, very importantly, keep you connected to the work of the team because you're not able to apply your skills. You're not able to put them in the course of a game to help the team win a game, but you're still part of that team. You're still a vital cog in the machine. And who knows, maybe you're an injured player, but you're one of those players that your teammates look to and they need you to feel good about the effort. And you can still do that in the locker room with your stupid boot on your foot or with your crutches under your armpits, right? That doesn't change because you can't get out there and play. And what it does for you is it keeps you connected to the ultimate work of the team and the ultimate goal in mind, which is to win games. And you might just help that team win a game without being able to put on a pair of shorts.
Absolutely. Well said. The lone wolf dies, but the pack survives. That you like you said, that player might be Mr. Positivity. That player may have had a tremendous personal story that teammates are that pushes them and inspires them, and seeing them show up and they're bringing that boot and that cast that the whole team signed, and uh, that pushes them to that extra step that's gives them purpose and the why, and that's 100% drives the model of what I do here, which is when we have injured athletes, they are now in the TNT rehab, which is essentially just, right on the other side of our performance center, which so they're not removed from being around, quote unquote uninjured or functioning athletes, even though, these are still functioning athletes and they could still move. Um, and our goal is to integrate them back with their teammates as soon as possible. And they may not be doing everything in the program, but they will be getting there. They'll be getting their breadcrumbs and their Scooby snacks. And they will, of course, will be doing our rehab. But it's just, we just adjust and kind of meet them where they're at. But, we have a great support system and a lot of positivity from, all their peers.
And for our attendees on this call who are coaches, I mean, this is where this is your opportunity to come in and let your players know that they're still a vital part of the team, right? They still play a role in the effort to get a win. And I think that's really key. And for those of you who are parents on this call, it's important to let your student athlete know that your team still needs you. Your team still values your work and the effort you put in to the end goal, which is to get a W, right? And if that's not the case, then let's change that. Let's figure out how to change that, right? I sort of sound like Ted Lasso, don't I?
Such a good show. Be a goldfish, right?
Yeah, right. Be a goldfish. Exactly.
So when it comes to being prescribed opioids, what are some of the things that patients should know prior to and following being prescribed an opioid after they've had an injury, a surgery, or for whatever the reason may be?
Sure. I think the opioid is a tool in the toolbox. It and it can be a necessary tool in the toolbox, right? The opioid is one thing that you can use to help deal with pain that comes from fixing the injury, right? Like we always tell patients, regardless of how they got into the pre-op room, we always tell them, you're here because there's a problem, there's an injury, and it needs to be repaired because it's continuing to cause chronic pain and it's preventing you from doing everything you need to do. Surgeon's going to fix that. She's great at it. She's got a lot of skill and ability. I don't want you to worry. The cost of that is that you're going to be left with some more pain, but that pain is going to be the pain of surgery. It's going to be really defined in a very short time. It should be, right? Because what was causing the chronic issues, she's going to fix. So we're going to think about the idea that we're going to be left with a little more pain, but that pain has a has an expiration date on it. And we're going to come up with some tools. And so I think it's important. That's why I talk about the idea of functionality when it comes to pain. You feel pain, but how are you doing, right? And we kind of give them that guidepost of how do you assess your ability to function even if you have pain, and if that function is really impacted to the point where you can't do some of these basic things that you need to do to get better, well, that's a point where you'd want to use an opioid. But if you can function effectively, but you still have pain, we might want to deal with it. And there are other opportunities. And that's where we talk to people about how to understand, do I use an anti-inflammatory, or do I use something like acetaminophen, the brand name is Tylenol, that helps kind of knock down the intensity of whatever pain I'm feeling, right? And so I think those are important things to know. And if we frame it in the whole idea that pain is that the pain after surgery or the pain after an injury is really a short duration element, then that wraps the opioid being a short duration element in there. And if we think about the idea that there's a lot of opportunities to manage the pain without ever getting to an opioid, then very often you know that it's a short duration thing. You understand that it's okay that you may have only used just a few doses. You sort of get a feeling of understanding when the opioid isn't even in the picture. And once it is, it's time to get rid of it and discard it. You can look for things, very often we hear about the take back day, and the Prescription Playbook often puts out DEA's promotion for those upcoming events. And those happen twice a year, but year round, there's opportunities to find some of those kiosks that are out there in pharmacies and hospitals and even municipal buildings, police stations, fire departments. And you can always get rid of the opioids there. There's no point in keeping them around. It's sort of like having an old umbrella, and if it rains again, you just get a new one.
Extremely well said. Yeah, as a sports rehab physical therapist, movement and proper movement. I just heard of mice instead of rice recently, which I think is awesome. Movement. So as a movement guy, I'm obviously very biased towards exercise as an analgesic or something to help reduce pain. And as the Illinois Human Performance Project knows me, I guess I'm the breathing guy, as I did a breathing presentation about a month ago. I'm a big proponent from my martial arts background and fitness and just using breathing, structured breathing, whether it's box breathing, or that's just the breathing you do when we start to do, cardio conditioning and certain exercises. Breathing is a great way to help deal with the pain. And as someone who was injured high school athlete myself, and unfortunately had to take opioids because of a fully dislocated elbow. Luckily, I had some good healthcare providers and a team to help get me off those as soon as possible and back moving, and keep me from going full Batman mode into a dark cave and get back with my team. Yeah.
Thank you both. Sterling, I just loved your answer of really listening to your body of have you taken these opioids for a few days and now you're feeling a little bit better? And how is it going to be if I go for a day and I don't take them? Just because your doctor prescribed it to you doesn't mean that you have to take everything that was given.
Absolutely. And if you're really kind of thinking about it in terms of functionality, the opioid is the tool when the pain is limiting the functionality beyond an acceptable level, right? Otherwise, you can function fine. You can function okay with pain. We do it all the time. Everybody on the planet does it all the time, right? The opioid is there to help you regain a suitable level of function, right? The idea that life is going to be pain-free is a myth, right? And it's a myth on all levels, including on the physical level, and especially um when it comes to competitive athletics. I mean, you hear coaches scream it all the time, play in pain. Well, you're going to have to work, and you have to live a little bit with pain, right? And that's just a part of life. And so those opioids are that kind of that sort of last ditch tool, and really they have an expiration date on them, literally and figuratively. And the figurative expiration date comes long before the literal one. I think it's helpful to think about it that way.
And I think making sure that like the healthcare team, like people like myself and Sterling are kind of communicating or doing our due diligence to educate the patients that, typically in the beginning, the acute, the really painful times if opioids are prescribed, that's usually around when you see my smiling face as far as timing of taking that to help with pain from some of your therapy. I did home health for a little while, and usually you take that so the opioid before I arrive so that it's in effect so that we can get through some of the work we have to get through. But with that said, we want to make sure that again you realize that getting off the opioid as soon as possible is probably a good thing. And then once that happens, because we're now timing it with your exercises, you may feel a little bit more pain now, but that's not necessarily a bad thing. And like pain is okay, especially when we're kind of building back up, if you will.
Well, sure, and it's important when you feel pain to ask yourself. You go through and you figure out, are you still functioning? Because again, if you can be functioning fine, and then you say to yourself, well, what does that pain feel like? And if you feel that pressure and stiffness, and you don't have any issues with taking an anti-inflammatory, well, that might be a great opportunity there, especially because now you're starting to treat the root cause. The other thing I think that's really important to remember is that opioids will never treat the cause of pain. They will help your body. They will help mitigate the volume of pain that your brain can appreciate, but they will do nothing to eliminate the pain. And very often, especially in that acute setting, that post-surgical or even that immediate post-injury, the pain is coming from that building, just steamrolling inflammation. And so very often reining in the inflammation, not necessarily eliminating it, because again, remember we talked about the idea that inflammation, especially in the acute setting, can be helpful for healing, but reining it in may be the most effective way to deal with the pain, and you're actually treating the root cause.
I think that was so wonderfully said, Dr. Elliot, just on what opioids actually do and how we can support ourselves outside of taking it, and to understand that it's not the fix all. It's just kind of helping with that pain management, but it's up to us to do the work to actually address the pain that we're in.
Sure.
Okay, so we have a few questions that I would love for us to get through, and then we'll take some final statements and start to wrap up. So first question we have is, when can athletes go back to light training after ACL reconstruction?
That's an it depends, it depends on the kind of severity, it depends on the graft choice, it depends on how have we been progressing through the treatment. I've had, I have one case of an athlete that has a quote unquote typical, very smooth recovery process. Another case, unfortunately, I had an athlete come from like another provider, had a history, unfortunately, of getting an infection following surgery, and so that case is very different than the first case. So that's just kind of depends, and depending on surgeon protocols and kind of what I would
Yeah.
see in an evaluation, and then, work with the surgeon and the healthcare team, work within their protocols, and then work with what, quote unquote, the Scooby Snacks and breadcrumbs my physical therapy evaluation will reveal or would reveal.
Right. I mean, it's really, it's dependent, I think, on the progress of the individual, how they're recovering, and ultimately, as we advance, as we advance rehabilitation, are we making positive progress, or are we going to get to a point where we're going to take a step back? And are we going to take a step back because we pushed it too far? Right. And so I think those are always things that have to be balanced. It takes evaluation by the training staff, takes evaluation by the physicians. And, and it takes a lot of work in sort of blunting the athlete mindset, which is get me back out there right away, dude.
Yeah, we got it. Sterling and myself have like chains, holding some for sure.
Sometimes,
Yeah,
sometimes you do. Yeah,
absolutely.
sometimes you do.
And
Right.
sometimes on the other end, there's definitely the athlete that is like extremely afraid of re-injury. And
Mm-hmm.
so we kind of have to be chameleons for sure and
Yeah.
meet the athlete where they are for sure.
Right. That's the other end of the spectrum, right? And there's points at which we have to face our fears. It's a metaphor for life, but there's points at which we have to face our fears. And one of those fears sometimes for athletes is the fear of coming back, right? And every athlete will tell you, I even though they told me I'm ready to go, I knew I wasn't ready to go till I took the first hit, or I knew I wasn't ready to go till I made the first cut.
That
Yeah.
is the perfect segue into our next question, coming from an athletic trainer, asking, how can coaches and ATs and PTs manage that return to play fear with their players, and how can they just help them to overcome that fear of getting back to playing and getting back to that full contact sport?
From my perspective, it's to put them in is to one, make sure that they understand like their numbers, right? What gets measured gets managed. So I try to make sure that the athlete is aware of like it comes back to goal setting, like where are we trying to go and what are the steps? And um those steps are what activities, what exercises, what tests are we trying to get back to? And as I explained to a lot of my athletes with, there's evidence-based testing, there's results-based testing, and some of the specific stuff that I like to do is, depending on, again, the SAID principle, the specific adaptation to impose demands, kind of depending on what you do. If you're an athlete that has to have more strength endurance capabilities, or produce power through long durations of time, you're a young, strong, high performance athlete. You could probably do pretty good on the first rep. Can you do good on the 100th rep? And um, so once some athletes get through the return to kind of play testing and protocol, I think like first of all, the small wins to get there, to get to where we were to do that testing, that gives them mental and emotional and physical like confidence. And then clearing that testing is also a big mental confidence boosting kind of event. And then having a good conversation, if you're a coach or you're an athletic trainer from a school, just connecting with whoever's working with your athletes so that everyone's kind of on the same page and can support that athlete where they are. And I think that's when you have all that support and the message is unified, that's it's kind of a positive way of groupthink, I guess, but it's a good way to positively support your athlete and the families and parents who may also have certain fears or wanting to push the athletes back out there as well too.
Yeah. Listen, I think I think it really comes down to understanding that there's a point in time where where the rubber has to meet the road when it comes to progress, right? And so yeah, it can be fearful to get back. Everybody has that, but I think it's a mindset issue, and I think it's really getting the athletes to understand that for this, you work toward this. This became the goal. The goal is here. and it's time to accomplish it. It's time to achieve it. I think that's sort of the psychology of it, right? Which is hard, but it's a necessary component to any type of achievement of success, regardless of what you do.
And to circle it way back, this is why being around teammates is also so important, because they
Yeah,
see you hitting these milestones and it's like, oh, nice job, Sterling. Wait, get after it. You're doing awesome. Fist bump, and
yeah,
yeah, those are huge mental wins, and yeah, really like build up an athlete's confidence.
yeah, very much so. It's a great point.
Okay, so another question we have is a very hot topic right now is performance enhancing drugs, especially within the bodybuilding community, which does have its really large influence on youth, which can be super dangerous. So, just what are your thoughts on peptides like BPC 157 and TB 500 in terms of healing from injury?
I'm going to be honest and tell everybody here that those are items with which I am not I'm not incredibly familiar, right? We spend a lot of time, especially in the orthopedic world, around this concept of something that's called regenerative medicine, and I should have probably done it in the Dr. Evil style, air quotes. Um, but it's sort of I think it's sort of a misnomer. What I will tell you is that what we generally know is that there are not that many agents out there that you can introduce to the body that are known to truly regenerate, that are known to truly dramatically affect healing, right? Some things can be supportive, and there's a chance that these things are supportive, but I think in general, the basic principles of healing, which is suitable amount of inflammation, managing inflammation, and returning to effective movement. Those are always the time honored, tried and true, tested ways to get better. It's my opinion.
Yeah, I believe, like I mentioned, universal elements before, which is just kind of, I always say it's good to have a lot of resources, but it's just good to be kind of resourceful. And that, to me, that's just you figure out how to be resourceful so that you can hit those universal elements. How can I get my sleep? How can I optimize my sleep? If how can I make sure that I'm hitting my protein requirements so my body can heal from this injury and getting all my other macronutrients? When am I getting those meals in, making sure that I'm doing that consistently and consecutively, not just doing it 1 day or 2 days after you set up the plan, but doing it long term, doing your training and your rehab and doing it intentionally and specifically for what you're trying to do. If you're a thrower, you're not, training like a marathon athlete, for example. Everyone's looking for the silver bullet, if you will. I don't believe there is a silver bullet, kind of like Sterling said, and there's no way to there's no way to circumvent just good old fashioned taking care of yourself, sleeping right and mitigating stress as a student athlete with all the screen time, all the lights, and dealing with homework and all that stuff. Stress mitigation. We have athletes that come to me that drive from all over the place. So having, again, like dealing with stress. If we have a extremely, it's Monday or Wednesday and we have a high intense workout, but you're not feeling it, that we got to have those conversations so that we get the work done, but we scale it so that we're not, like Sterling said earlier, like going backwards. We're just continuously dealing with the ebbs and flows and rolling with it and trying to make progress.
Okay, awesome. I know that we're over time. I appreciate anyone who's still here. We're just going to wrap up with one more quick question, and then let you all go. But what role do you guys think that nutrition plays in the topic of pain management, inflammation, and healing from an injury? And are there any micronutrients or foods that we should be encouraging athletes to focus on during this time of healing?
I think nutrition is one of the core elements of successful function of the human body. It has been, it always will be. When people are horrifically acutely ill in the hospitals, we are constantly evaluating nutrition for the purposes of healing. And the more effective your body is at healing, the more effective it will be at contributing to managing pain. That's very simple.
Yeah, nutrition is key. I used to, my sister-in-law is a registered dietitian. So uh, having your building blocks and that's one of the universal elements. That's if there's a silver bullet, it's sleep, it's nutrition, and it's
Right.
good training, and then it's good social support and that positive energy and mindset from yourself and everyone around you.
Yeah.
Awesome. Okay, well, any final thoughts from either of you just on everything that we've talked about today? Anything that you want to leave our attendees with as we before we wrap up?
Sure. I'll leave you with a very simple thought. I think that injury is a reality of competitive existence, and pain is a consequence of it. Um, and if you think about it that way, then you understand that it's a defined element. And I know I've talked about this several times. And if you treat it that way, and you understand that there is the opportunity to improve and recover and get better, then I think it's an effective, positive way to approach what will be in the history of the athlete's time a very short chapter, and there's a lot of positive opportunity ahead.
Yeah, I would like to just leave with athletics is supposedly a microcosm of life. It's just a very smaller scale, right? And dealing with an injury is a reality that most athletes will deal with, big or small. So again, that opportunity for personal improvement, goal setting, understanding how to get through that adversity, doing it positively, so you don't sink the ship and kind of bring everyone else around you, but down, but rather, go up and bring everyone else with you up. Um, and being able to learn how to do that will serve you well throughout other life adversities. I'm a DPT, Sterling is PharmD, but unfortunately at the end we're all RIP, and we're all going to have to deal with loss and struggles, and dealing with that as an injured athlete hopefully serves you well and gives you the experience to move forward and deal with other struggles in life. And that's what I think being an athlete is supposed to be all about.
Indeed.
Alrighty, well, thank you both so much. Both of your insight, your knowledge, all of your experience is just so appreciated and so important around supporting athletes as they grow and go through whatever life may throw at them. So thank you so much to everyone for your time today. If you're interested in any of the Prescription Playbook's other resources, you can scan this QR code or check out our website to find a plethora of stuff. And to anyone whose questions did not get answered today, I am so sorry. But if you are still interested in reaching out and having this conversation continue, you can do that right here. You can connect with me. My email's down here, and we also have the email of Dylan and Sterling. And we would so appreciate if you guys would take an evaluation on this webinar so that we can figure out how we're doing, what topics you might want to hear next time, and so we can all continue to grow. But thank you so much for all being here, and we will make sure that the recording is sent out to everyone who registered to attend. Thank you so much, and especially big thank you to Dr. Edwards and Dr. Elliot.